Hello and welcome to NUTV News. My name is Jessica Grill and we're sitting down with Dr. Susan Mello, an assistant professor here at Northeastern. Dr. Mello has done some research on communication regarding the Ebola crisis, so we're going to ask her a few questions. So from your research and your just general observations, how has coverage of the Ebola crisis differed from other health crises in the past, and how has it been similar?
I'd actually argue that it's extremely similar. It's possible that, and research hasn't been done yet on coverage of Ebola to track exactly how much it received over time, but just anecdotally, it seems to mirror other issues in the past, so SARS, West Nile virus. What happens with these types of epidemics is that there are issue attention cycles. So for whatever reason, attention to the issue will increase, and then over time, another issue will come to the forefront of news, and coverage of that particular epidemic will decrease. And I believe that's sort of where we are right now. So in September and October, when Ebola became more of a risk to the United States because we had actual cases in the country, coverage went up. Way up. I mean, Ebola has been an issue for most of this year, and we hadn't seen coverage in the United States ramp up until September and October. But now that the cases, the monitoring and the quarantines have been effective, people have been released from the hospital, what we're seeing now is coverage dipping. And that's very similar to other issues that we've seen in the past. So it's a very predictable response. I'm actually extremely relieved that coverage has gone down because I was very nervous that they were fear-mongering, that the journalists were trying to get people's attention, because that's how they make money, by kind of creating an ambiguous and a very important and kind of emergency type issue, right? Like, Ebola's here, the threat is present, and we need to panic. And then it became politicized with the midterm elections, and the coverage became sort of bifurcated, and people like the CDC and other organizations saying, don't worry, we have this under control, don't panic. And then the politicians saying they're dropping the ball and they're making mistakes, and creating sort of institutional distrust. So we were getting kind of these mixed messages through September and October before the midterm elections, and I was really nervous about how that was going to affect people's responses to Ebola, stigmatization of countries abroad, people who were here from those countries, or even from the entire continent of Africa. We saw stories coming up here and there, how people were being profiled based on where they were coming from. And we don't want to see that. There should be a fair treatment of Ebola, and news coverage should be objective and balanced, but there's always this tension that they want to cover what's exciting, what's new, what's uncertain. And in terms of risk perception and how people respond to that type of information, it's a little worrisome. So I'm glad that it's calming down.
So my next question is, what do you think the best course of action is for Northeastern officials to take regarding the Ebola crisis?
So I actually commend Northeastern in the way that they've handled the issue thus far. I recently went on the University Health and Counseling Services website, and very prominently displayed is an entire section on information about Ebola and how students should be responding, faculty and staff, to keep them informed on the issue, on updates. So that's great. I've also noticed through Northeastern News that there are actually a lot of faculty who are engaged in research to track and combat Ebola. So there are people here working in network analysis and nanotechnology, trying to find ways to project where Ebola will go next, and also creative ways that we can reduce the risk of contracting Ebola and help people survive the virus. So Northeastern's pretty active right now in the Ebola crisis. Moving forward, I think that where we're going now that the issue in the United States has been contained, and the cases and the quarantines and the monitoring have all been relatively successful, you've seen news coverage dip. And I think where Northeastern can contribute and where students can contribute is in combating the issue abroad. So Ebola is still raging in West Africa. WHO is reporting that cases are still escalating in certain countries. And they need a lot of financial support. So right now, WHO is projecting that they need somewhere around $260 million to combat the disease and contain it in West Africa. And unfortunately, they've only received about 49% of those funds. So the United States and people in Northeastern can play a major role in helping finance the battle against Ebola. And communication scholars have done lots of research on how we can persuade individuals to donate. What we can do as communicators to encourage donations is to create what's called an identifiable victim. So experimental research has showed that if you show people one identifiable victim and ask them to donate, that it increases emotional response and people feel more willing to give. If they feel like the issue is so immense that the death toll has reached 5,000 and it's spiraling out of control and there's nothing that they could do, it's just their one drop in a large bucket, they're going to be less likely to give.
So what are your thoughts on how Google and Facebook have approached the issue of Ebola and how they're encouraging people to donate to the cause?
I was actually very excited last week when I was on my news feed. I was immediately noticed that at the top of my newsfeed, Facebook had posted, "Donate to help stop Ebola." I think it's fantastic that that's where they're placing their efforts. I was a little bit frustrated with Facebook, not the organization necessarily, but the communication that was occurring on Facebook when the issue ramped up in the United States. And there was a lot of news coverage. People were sharing stories that were from sites like The Onion, which were not based on legitimate issues or events that were occurring, and there was satire, and people were kind of reacting as if they were true, which was really frustrating for me, which speaks to the idea that people should be media literate and know which sites they can trust and which sites they can't. But in terms of the issue of donations, so what I thought Facebook did that was really great was they used what's called a gain frame. And research in health communication has shown that when you talk about positive consequences of engaging in a recommended behavior, like donation, people are more likely to give.
So my last question for you is, what advice do you have for just media viewers, Northeastern students, people in general, of how they can manage just the sensationalized information that we get and just respond in a healthy way?
Sure. So news outlets are inevitably going to sensationalize these types of issues. And as the more that they sort of have this exciting dialogue on television about these issues, the more people respond. So that's what the news networks want. They want to get you to respond. And it's natural for us as human beings who are programmed to survive in life from day one. That's what we do. When we encounter this sort of threatening information from the media, from our friends and family, it's perfectly natural to respond in a way that becomes protective. You immediately want to reduce the threat to yourself, especially in the context of health. So what I think is important is that students recognize that that's a natural response to have when you encounter threatening information. And what's important is that you recognize how to stop, let those feelings kind of work themselves out, and then go and find information for yourself. So looking for websites that end in .edu or .org and not going to satirical news websites or random blogs or relying on Aunt May in Nebraska to give you your information about Ebola or her personal opinions, and actually tracking down legitimate sources. And we found from research that just the act of seeking out additional information related to health issues is soothing and calming and reassuring to people. So I would encourage students to just go look for more information and make sure that the resources that you're using are credible.